Well, you know, if we look at the organizations, non-governmental organizations that showed up at Haiti, they measure in the thousands. You know, 95% of the work is probably done by 45 of the major NGOs, but there's a lot of mom and pop shows and things like that that show up. And this has been the case, but certainly in Haiti because it's so close to our own shores. Haiti, in terms of coordination, was a debacle. In part, the large majority of people who showed up were under the age of 30, and this was their first disaster event. But best practices were not necessarily occurred. And this, unfortunately, non-healthcare providers were doing amputations and other things. But there are a lot of stories that are very worrisome about that. But the point is, it's just another example of how we haven't been very good at coordinating this mass of people who need to come together. But OCHA, the Office of Coordination for Humanitarian Affairs, which I think has the best in terms of managers for disasters, but they always struggle for resources and funding, along with PAHO, so the regional organization for WHO, and others that were part of that, met in Cuba, and really discussed, gee, what are we going to be? What can we do? It really is uncovering something that the humanitarian community has probably silently just wished for, but more accountability, more accreditation of the people that show up, you know, we certainly relish the humanitarian spirit of those who show up, but we have to have some coordination to ensure the best practices occur, and it's directed it goes in the right direction. So there are discussions, and this is going along with the fact that there's a movement afoot with the humanitarian community itself to finally professionalize humanitarian profession. This is really taking hold. The NGOs, certainly over 80% are saying, yes, it's about time. So we can see something good on the horizon. Coming back full circle to the Harvard Humanitarian Initiative, we deal with the health side of it. You know, we have about 11 different clusters that OCHA deals with. Health is just one of them, but logistics and transportation and things like that. But the professionalization blueprint really calls for courses and curriculum and best practice standards for all the what we would call the cluster aspects of it, and to ensure that in the future, hopefully in the near future, we have a better kind of response, a more coordinated response than we saw in Haiti.